Thank you very much, Julie. Hello, good evening, everybody. As those who are regular attenders on our webinars will know, my name is Greg Davis. I'm current chair of the London branch, and I'm delighted to be able to welcome this evening Rosie Russell, who, as well as being a IIRSM council member, is also a committee member on the London branch, who's going to talk to us today about Planet Interrupted and some of the lessons learned from the COVID-19 pandemic of, well, still ongoing, but which started in 2020. If you do have any questions, as usual, please can you put them in the either in the chat function, or if you're happy to relay them through that will be brilliant, and then Julie or I can ask them at the end. So just leaves me to introduce Rosie. Thank you very much, everybody, and Rosie, over to you.
Good evening. I'm Rosie Russell, and thank you for the introduction, Greg. I'm, as well as being a IIRSM council member, I have a full-time job as the head of health and safety for Mira GTX. We're a small research phase pharmaceutical company based in New York, London, Shannon, Amsterdam, and Ghent in Belgium. Really, I'm going to split this talk into two halves. The first half is going to be around the Planet Interrupted issue of the IIRSM Sentinel magazine, which was an original piece of work taking a look at how COVID had impacted the risk management professions and also the lessons that we could carry forward. After that, I'm going to come on to a few slides of my own, really talking about how COVID impacted me professionally and what I feel I've learned. A little bit of background there. I started my current role 4 weeks before the first UK lockdown. I had zero operating experience of my current company to pull on. So I had to really find talent within the organization fast. And I got through most of COVID-19 on my own wits and experience. So IIRSM, for those of you who are guests, we are a global community in 90 countries. We have memberships from free student memberships through to fellows at the highest level of membership. We have branches all around the world, of which London is one, and we have an emerging risk leaders network of really the up and coming risk leaders. We have a fantastic mentoring scheme, and that can be useful to anybody at any point in their career who's looking to upskill and move up to the next level. We have the Sentinel, which really brings us today's webinar in terms of the publication on Planet Interrupted, and then training courses and qualifications as well. So Planet Interrupted was IIRSM's contribution really to us getting back on our feet following the pandemic, and really to give us some of the lived experience of people working in different risk professions. I myself, I'm head of environment, health and safety, and that's very much where I draw my experience from. However, there are people in the publication from pure business risk to supply chain and many other areas that handle risk. And it gives some findings from its first survey of its kind on risk management during the pandemic. And there were a lot of impacts on the world. Borders shut down. Suddenly we had issues about transporting materials. We are a globally connected world. Globalism has given us many benefits, but it has extended supply chains across borders. So suddenly there was a reduced capacity to move things. At very short notice, businesses that had no experience of flexible working had to adapt. My business was one of those. We are pharmaceutical research, development, and manufacturing, not something you readily do from your spare room. And those new work patterns brought different risks, which I will talk about, certainly under my own experiences. We had to adapt to hybrid working, we suddenly had to get used to webinars, Zoom, Teams calls. And just as we thought we were getting to grip with COVID, down the line came another variant. And this quote from Peter Kinselli, he said, "In my experience, most organizations are now looking at hybrid working for the long term, not just the short term. As the COVID experience has shown senior management teams that they can trust people to work remotely." I think we can say in an awful lot of workplace environments that the level of trust in our workforce was probably quite low. After all, what was the reason of having managers if there were not people for them to directly oversee? Yet, we've actually now found that there is a happy middle, that people can be very productive from home under certain circumstances. But that does also introduce other risks. So if businesses were really not aware of what their risk owners and risk managers were doing in the background, they found out during COVID-19. Senior leadership suddenly had to become hands-on involved in risk. There were crisis management meetings. They were suddenly having to collaborate between perhaps local businesses, to get through as a collective. And risk and safety professionals were operating absolutely every level of the organization. One thing that happened for me very quickly as we went into the first lockdown is I was asked to chair the senior leadership team. Now, sure, I was on the senior leadership team, but suddenly I'm chairing it. So things were very different. Working in the background to identify and reduce risk was no longer the role. It was working at the forefront in the visibility of absolutely everybody. And the way that we collaborate now, both in the organization and between organizations, it's powerful. It will have a very positive outcome for risk management. This will leave a lasting legacy. I'm paraphrasing Catherine Fry here. I think that the impact that we have been able to have as a profession has been profound, and that most senior managers are now recognizing this. And in the survey that was done as part of the Planet Interrupted issue of Sentinel, some questions were asked. And the first one was, how well did your organization adapt to the immediate impacts of COVID-19? And for me, this is an incredibly positive picture, because we found that more than 3/4 of respondents rated an 8 or above out of 10. This suggests that most of our organizations are not very fixed in their working practices, as perhaps we might think they are. But in actual fact, in the face of a strong enough push from outside the organization, that actually adaptation is possible. That's certainly the experience that I found. Now, okay, my organization is quite young, so perhaps it is in many ways more flexible. However, people drew together and we found skills from across the organization that we could use. They weren't necessarily from where you might expect them to come from. And the second question was, do you believe your organization recognizes that its success is linked with the health and well-being of its employees? And again, more than 3/4, in this case, rating 7 or higher. Again, I think that's incredibly positive. And it very much was our experience that the #1 risk that we identified going into the pandemic was the health and well-being of our employees, and not just physical health and well-being, but mental health and well-being. In the face of what was going to be unprecedented change and unprecedented ways of working, the organizations instinctively understood that they needed to step forward and actually get involved in every aspect of employee life, which before the pandemic, I think some people would have probably found uncomfortable. And then how well did organizations support health and well-being during the pandemic? Well, with very little baseline experience of how to do this, the picture is perhaps not quite as good, but still, you've got 2/3 at an 8 or better, more than 3/4 at a 7 or better. And the last one, which was, has your organization recognized the need to improve levels of investment in risk and safety management competency skills? And actually we see, again, a strong response here that actually certainly the majority of organizations have seen that this is somewhere where they need to spend time and invest. And in fact, actually, IIRSM has responded with our Introduction to Risk Management course, the joint course with NIBOSH. So what's the future of risk management? Well, I think we have at the moment an elevated status of risk management. For those of us who are working in these roles, it's incumbent on us to keep that visibility going, to make sure that we've got more involvement at the strategic level, because if you've been recognized for adding to the business in actually providing support that's allowed the business to function well, then there's now an opening for us to really push up. Certainly, we should be showing that we are an investment, not a cost. And in fact, an awful lot of what we did, whilst there may have been costs involved, allowed businesses to keep running. But for me, this focus on learning development is key, and it's certainly something for me in my role that we have managed to unlock. And it's an understanding that risk management skills shouldn't sit in one person, they should sit across the business, because collaboration is absolutely key. Now, Carl Lagarde said, as a risk or business continuity manager, you need to run different scenarios, thinking about the best and worst possible cases, as well as the one in the middle. You need to ask what mitigation measures you can put in place now to prevent you from getting to the position where you can no longer continue to operate. And as we're coming out of COVID, it would be very, very easy to slip back into the norm of a few years ago. But one thing I've got to say is COVID's not gone. And respiratory diseases and other potential pandemic diseases have not gone. We are a globally connected world. That was shown very clearly in how quickly COVID spread around the globe. So don't think it's going to be another 100 years for the next pandemic. I don't wish to sound gloomy, but with some real preparation, perhaps we can weather the next one with a little more ease. So for me, some lessons that I think I would like to talk about. I mean, the first one is the pandemic was not unexpected. People who are surprised were just perhaps not as aware as they should have been. This should have been on business risk registers at the highest level from the point when the UK government put it on the national risk register, which was about as early as about 2010, which in many ways was bizarrely late considering SARS and MERS were around 2003, 2004. Because after all, COVID-19 is SARS coronavirus 2. And bad influenza seasons were not that uncommon. A lot of larger business already had contingency plans for number of staff being off with influenza. But someone infected with influenza on average infects 1.2 other people. So for every 10 cases, you get 12 in the next generation of infection. For the original COVID-19, that number was 3. So your 10 cases become 30, become 90. So, and now that number is nearer 12. The current strains of COVID are about as infectious as the measles. But just to show that the pandemic was not unexpected, research on a rapid response vaccine platform was underway as early as the early 2000s. This was work done by the Jenner Institute, part of Oxford University. It's now known as the AstraZeneca or Oxford vaccine, and I actually was privileged to work with that group when they were co-located with the Institute for Animal Health in Compton. Sadly, that site is now closed, but they were working on it back in 2013 when I was working with them. And in actual fact, the lab work that it took them to take the coronavirus sequence and turn that into a vaccine was done in a matter of 10 weeks. But it wasn't. It was actually done in a matter of 20 years because of all of the work that was done before. So if the pandemic was not expected, and this is unlikely to be the last one we're going to experience, it might be time to start looking at your plans again. Now, while things are fresh in your memory. It's possible right now to get teams together that have lived through this and do a series of after-action reviews. Sit down, get your management teams together and ask just 3 questions. What went well? Hopefully that's a long list, because that's the things you can learn from and say, we're going to keep doing those. What didn't go so well? Okay, fine. Those are things that will then lead you to ask the 3rd question. What needs to change before next time? And it's as simple as that. And in the military and the fire brigade and a lot of other emergency response organizations, after engagement with the enemy, shall we say, they sit down, they do exactly that process. Work out what they want to keep the same, work out what they need to change. And this leads me on to the second point, is the pandemic was not well prepared for. There were national stockpiles of PPE, but they were inadequate, out of date, or of the wrong type. And that just-in-time supply chain models leave very little slack in the system. There isn't a big warehouse of material to suddenly draw on. And for those of us in the UK, Brexit complicated everything. I make no comment on whether Brexit was wise or not, but it's certainly where we were in the process of leaving the European Union, it complicated everything. So the question is, what will you need next time? What is it in your business that you will need to have to hand? What's in your battle box for when the enemy comes over the crest of the hill again? There were some things I had to get good at fast. Now, fortunately, I've got a lot of experience to draw on, some of it working with people who have worked on zoonotic diseases. So I may have been slightly more fortunate than some people in terms of my experience that I could draw on, but I suddenly had to become an adept crisis manager. And this wasn't an injury at work, a crisis that you're going to deal with the aftermath, get back to working normally. This was going to be a protracted, slow motion crisis. I had to become a communicator, because we can, as managers, we can make the best decisions in the world, but if our staff on the ground don't understand what we're thinking, what we're doing, and what we're deciding, they can become very unwary, very unsettled. High-level risk registers. Now, I'm used to dealing with risk assessments. I'm used to dealing with risk profiling. communicating major risks up the chain. But that high-level business risk register is not an area that I had necessarily spent a lot of time with. Yet suddenly, forget just about everything that was on that risk register. COVID was at the top, and they were looking at me. In terms of keeping the workplace going, because as I said, we're pharmaceutical manufacturing and research and development. We can't do that from our bedrooms or our kitchens or our spare rooms. So I suddenly had to become an expert in infection control. So all of the biological safety work that I've done over many years in laboratories suddenly was coming to good use in offices. I had to become my own track and trace function early on, because if people got declared as a contact, they were quarantining. But what happened if I had a case on site? Were my control measures good enough? Had we maintained social distancing well enough? So I literally became my own track and trace service, and I was leading the leaders. Certainly for the first month or so of the first lockdown, the senior leadership were looking to health and safety for leadership. So to get ready for next time, identify the talent in your organization. There's a lot of it. Develop them now. Back to the slides from the report. Learning and development is key. Make sure people can talk the language of risk, that they understand about risk mitigation and controls, and that they can do so in their own sphere of influence, but also work cross-functionally. Something else I learned is that excellent business managers do not equal excellent crisis managers. So again, this is leading the leaders. Whilst I had a fabulous senior leadership team around me, and I was blessed here. They understood the business really well, but I was doing the crisis response. And to do that, I had to know my data well. There's no point going into a morning management huddle if I haven't read all the stuff that's come out overnight from the World Health Organization, for instance. We had to make sure that there was clear, decisive decision-making that we could collectively stand behind. And that did lead to some creative conflict. But we kept it at that level of creative conflict. And we discussed openly, honestly, and we came to an accommodation. We also need to communicate well. And that's up, down, and across the company. And when I say up, that's up to the executive team. Down, that's the employees who are being affected by this on a day-to-day basis. Across, perhaps to other sites, to leaders, say, this is what we're doing. And cross-pollinate ideas. But don't ever forget, in a crisis, empathy. Because in a crisis, we can become emotionally quite blunted. So that means we've got to look after ourselves and our people and consider the impact of our decisions, especially when a crisis is slow motion the way that COVID was, because it's just going to go on for ages. Because you're going to be implementing a lot of change. And the health and safety executive recognized change as one of the 6 areas from which you can get stress. And it's stress for everyone, including the people leading this. So that stress management piece became very important. So we are faced now with the pandemic. And what did we do? Like just about everyone else, we stopped. And we made safe our operations and stopped. But I think the adage is never waste a good crisis. We moved swiftly into an engineering shutdown. We used that time when our clean rooms were not operating to get ahead on some things we wanted to do, because we could do that with very few people on site. And we were moving them around in taxis. Yeah, there was an expense to this, but as a company, we were no longer traveling around the world conducting our business. So there was a financial loosening as a result, because there were funds there to be able to do this kind of thing. But also, we very quickly reassured our staff that we were not going to be participating in furlough, because we were wanting to continue. After all, we're a research phase pharmaceutical organization with patients that we're trying to treat. So no furlough, no layoffs. Quite the opposite. We actually started hiring. And literally a week later, the senior leadership team, we'd got our head around the new operating environment, and we'd done our risk assessment at the highest level. We had COVID controls very quickly. It was perhaps a month or two after the pandemic started. We found these radio frequency buzzers that everyone could wear around their neck. It would tell you if you came within 2 meters of somebody. These were not all that popular because they were always beeping. Yet they were incredibly popular because they were reassuring, because people were having to try and figure out. We vastly reduced the capacity of our offices. We brought in hybrid working, but that did introduce new risks. We suddenly had to figure out how to do ergonomic assessments of people's workstations at home. So Teams, Zoom, all of this became very useful there. But there were other risks. Was home actually a safe location for people? Many of us take this for granted, but some people come to work for a respite from some of the dangers of being at home. If you're living at home with domestic abuse, for instance. So our policies had to recognize this, and we had to be ready to respond and make sure we can actually offer work as a safe location. We had on-site rotas to ensure that only the people that had to be on site were on site, because that meant we had enough space for social distancing. And here's one mistake that we made early on. The senior leadership team took the view that actually we could be off site and create more space for other people. But actually that senior leadership presence was seen as reassuring. So, like every other department, we had a rota and made sure there were senior leadership people on site, seen, walking the floors, talking to people. And those taxis. You could tell when it was getting towards the end of the day at Mira, because the street outside was lined with Addison Lee taxis looking for their next job. But our risk profile changed fundamentally. The way that we handled ergonomics had to adapt around home working. We had to adapt to make sure that people would be physically and psychologically safe when working from home. Being a young company, we didn't have an especially generous sick leave allowance. So would that force people to come in perhaps when they were technically ill and risk spreading COVID? So we had to make our sick leave policy much more generous. We focused on health and well-being. During the first lockdown, I ran a 5 things challenge, and it was purely people had little cards to note down what the one thing they'd done for themselves to help them relax that day. And this was for a week. Then we had a prize draw. However, we encouraged people to continue doing it, and it refocused some people's minds on what to do when you are locked down. We paid a lot of attention to mental health through resilience training and first responders. We trained people on, it's a course by the first aid industry body called Mental Health in the Workplace. It's an alternative to the mental health first aid course. It's much more workplace focused, and we have mental health first responders. And we did get into discussions with people about, well, were they working at home or living at work? And actually, that was actually quite a good discussion, because exclusively working from home isn't always the best solution, because you lose a certain amount of that spontaneity and creativity when you're working from home that you get from being together. So we would have specified teams would come in on a particular day in such a way that they could space out and actually work in an office and get some sense of normality. But there were some surprises along the way. And it turns out that the simplest of things can bring you down. Hand sanitizer. Whilst it didn't bring us down, we need hand sanitizer for making sure people's hands are on an assured microbiological state going into clean rooms. Without it, we can't operate. We got down to our last pack because our accredited supplier didn't have any, because everybody wanted it. And the solutions come from unexpected people. Our then office manager, she's now been promoted to a facilities manager. She heard that we had this problem, and she spent the day on the phone calling all of her calling all of her contacts, all of the suppliers she could think of, and she found us some. But she didn't stop there. She kept phoning, and she badgered the suppliers themselves to Purell, and secured us a supply that would allow us to keep operating. She's got nothing to do with the supply chain for our clean rooms, but she took it on herself to get involved. And I think for me, if there's one thing I really did learn, it's carry on collaborating. And no, that's not a 1960s bad film. It's really just a call to use all the talents. Because I made a list before coming on of all the people that I interacted with, whose skills that I drew on. And there wasn't a stone unturned over the last 2 years. I actually did use all the talents that we had available, and it worked. We kept the lights on. We completed a phase 1/2 clinical study and opened up a phase 3. And we opened up a 120 million euro manufacturing facility in Ireland. We cut the turf on that during the first lockdown. And we traveled to Ireland, a few key people, to keep that project on the go. The risk assessment and the code of practice for travel was a piece of work, I can tell you. But last week we welcomed in the Irish Prime Minister and we opened our facility. So in the face of a global pandemic, we have opened up a gene therapy manufacturing facility in Ireland. So the Sentinel report goes into a lot of these areas, and I would urge you to go and read it and reflect and conduct that after action review in your own organization. Work out, what is it that you actually did well? How did you get through COVID? What would you do different? And what do you now need to put in place? Because this won't be the last pandemic. It's not going to quietly give us notice when it's around the corner to allow us to prepare. So we need to prepare now. So thank you very much for listening. I'll stop sharing my screen now, and we'll hand over for questions and discussion.
Hi, Rosie. Thanks for that really interesting presentation. Interesting where you found some of your solutions as well. You never do know where you're going to find them. I don't have any questions come in yet. Greg, do you have any questions for Rosie?
Yeah, I've got one that's just really reflecting on the collaboration element and using everybody, Rosie, because the environment we work in is very much in operational buildings, and what we found was this necessary link between IT, HR, FM, and health and safety, who historically were not very happy bedfellows in terms of what they were looking to deliver, but all came together very, very effectively. And I was wondering, from your perspective, if you had any of those unusual collaborations between departments who may have not always seen eye to eye.
We certainly did. Security were one that I will honestly say I had taken for granted, but suddenly became so important. We implemented temperature monitoring coming into the buildings. Now, there is a debate as to whether or not that was effective, but this was something that the organization wanted to do. I took one look at the price of them and sucked on my teeth. But just at the right time, I bumped into our security manager and was talking to him and said, "Oh yes, I know a source of them." And what was going to be a 3-month lead time and about £6,000 turned into a 3-day lead time and about £2,500. But that was just one hint of how they helped us.
Brilliant, thank you for that. One other, if I may, with regards to COVID-19 related changes, so a lot of what we've seen around cleaning, hygiene, sanitization, you touched on, air quality was another one, distancing and barriers. Are any of those areas that have endured in the workplace post-COVID? So since they were introduced, what's stayed and what's gone, possibly, is the question.
So what's gone? The buzzers have gone. Hallelujah, said most of our staff, because they weren't having to constantly think about who they were next to. The screens between desks have gone. But one of the things that has stayed is an enhanced level of cleaning. It's something that we learned actually via the NHS statistics, is that during the COVID-19 pandemic, the incidence of gastrointestinal disease dropped. In fact, the gastrointestinal wards at hospitals were empty. Why? Because we were all using hand sanitizer, but many companies had cleaners wandering around cleaning hard surfaces. And we have retained that, and we have retained the reduced sickness absence as a result of it.
Okay, that's interesting, particularly from the format perspective, and it's one of those where I think everybody seems to be, and it is an expectation. It was a predominantly, I know there's a huge debate over health and safety, public health. COVID was very much a public health issue, but there's a lot we've all learned from it, and that one in particular. But with greater people awareness, there is an expectation now that they actually want to see this as the normal.
Well, I mean, certainly consulting our staff, one of the things that they said they saw as a real plus was having those on-site cleaners, because, you know, if nothing else, it meant the bathrooms were always clean. The staff room was always clean. The meeting rooms were always clean. So these little bugbears where you find, you know, some people have had a lunch meeting and, you know, they've left stuff behind them, were just seamlessly being dealt with. Yet it's actually such a key risk management exercise, and it is now on our operating risk assessment.
Okay. I have just one more question, which is from your perspective. When did you? A lot of people actually didn't really start looking at this seriously until the end of February, beginning of March. When did you first pick up on this might be an issue? And
So we had the WHO announcement on the 31st of December, but my first uh-oh was when I phoned up a friend a few days before that who works in the field, and they were busy. And this was between Christmas and New Year. So that kind of give me food for thought. So I followed it very, very carefully. But as I said, I've worked with zoonotic diseases before, and viruses can do three things. They have resources to do three things: how severe the virus is, how long the incubation time is, and how infective. And it's normally with viruses pick 2 from 3. And what we had in coronavirus was a 6-day incubation time. In other words, 3 or 4 days that people can move around the globe while infected and not infecting anyone. The virus can't be detected. And then we have got very high infectivity. Fortunately, that meant that the severity was likely to be somewhat lower, although I think coronavirus was really trying to make a bid for 3 out of 3.
It did, and it certainly looked to by way of it evolved. Although I think with Delta and Omicron, it seems to have substituted, as you say, pathogenicity for transmissibility. Really, that's the route it went down, fortunately.
That's actually what happens with a lot of pandemic strains. Is actually we tend to find that they become much more infectious, but much less serious. That's what we found with Omicron. However, that doesn't say there won't be another variant coming around the corner.
No, indeed. I don't have any more questions, Julie. I don't know if you've had any more come through.
Yes, I've had one more come through. So this is, did you find that those required facility suppliers were receptive to your control measures?
I think when I said carry on collaborating, I really probably should have listed just about all of our service providers, because I think I would have said before the pandemic they were just that, service providers. Now they're partners, because I had to work very closely with them. We've got contract cleaners, for instance, and training them on our controls was something that I had to work with them and had to explain a lot of things as to, for instance, why we could continue working. It wasn't so much that the controls that we had in place were onerous, it was that people wanted to be absolutely sure they weren't going to get COVID by coming onto our site. Maintenance engineers, filling in a COVID safe declaration before they would come on site, having them fill in the declaration to say that actually, yes, as far as we know, we're healthy. So I think it drove service providers to be much more of a partnership model, but for us anyway.
Great, thank you, Rosie. There's no more questions, so that just leaves me to thank you so much for your presentation. It's amazing how people are still learning after all this time and willing to learn from one another, which is a positive thing. Thank you to Greg for organising today, and thank you for those of you who have attended. The recording will be placed on the IIRSM YouTube channel. Probably should be able to get that done for you tomorrow. And those who want attendance certificates, they'll come out this time tomorrow. So we hope to see you at our next branch meeting, which is when, Greg?
Is the 19th. It'll be the 19th of October, same time, 6 o'clock, and we're looking to have a presentation on business continuity / resilience.
Excellent, another interesting subject. So I'd like to wish everyone a good evening and hope to see you at next week's webinar. Good night, everyone.
Brilliant. Thank you, Julie. Good night, all.